Cause even when I'm a mess, I still put on a vest when it's on my chest. Oh yes, and I'm super. Out the bed, y'all, because I just feel like better in the chair for now. On a scale of 1 to 10, my pain probably is like a 6, 7. I'm gonna take up half of a. I took extra Tylenol, and I'm gonna take half of a Percocet. Called all my loved ones. They just brought me more food. Major thing I'm having is not even the breathing, not the pain. What the fuck? It's like I got a brain fog. The main thing I'm having is dizziness. I took a meclizine. It only happens after I go to the bathroom. I've been to the bathroom twice. After I use the bathroom, I feel pain. Feel dizzy. I sit on the toilet for a while. And then, yeah. Ooh. But other than that, I'm good. I'm up in the chair. I'm moving too much, I know. So I do still feel stinging in my, thank you. She just came to get my dress and stuff that I wore yesterday to, take it so that she can wash. And shivering. Because I think I'm just moving too fast, trying to do too much. And I'll get cold because they have the air conditioner on. Because it is Miami. But I'm about to try to eat this fruit. I'm not going to eat the potato chips or much of the sandwich, but I'm definitely going to eat the fruit. And as much of it as I can. And then I will touch back the bases with you guys. Oh, just to let you know, it feels like I did intense cardio. That's what my stomach feels like. Oh, I can tell y'all too about the surgery. I was thinking about something. That's why my face went that way. I got in. As soon as I got in, took the nicotine drug test. Both came back good. Once they do that, they bag all your stuff up and take it. So I didn't get to text anybody. Anesthesiologist came in to put my IV in with no gloves. Didn't appreciate that. Then I asked him to tell the lady, could she bring my mom's phone so that I could text people so they won't be freaking out all day. She tells me it's on the other side with the nurses locked up. I can use her phone. I'm like, unfortunately, I don't know a lot of people's numbers. So I said it's okay. Then, not too long later, they walk you in the back. Dr. William has his own exam room with the blue wall. That's where he does his exam room. Got in front of the infamous wall. She took pictures. Then, without markings. Then Dr. Williams came in and took pictures as he marked. He came in. I was like, oh my God, I'm so nervous. He's like, what you nervous for? You ain't got to do anything. I'm just him. He started marking me. I asked him, I said, breast lift? He said, no, you're doing a breast reduction because you have a lot of breast tissue. I said, okay, so if I have to get a breast reduction. So my boobs hung really, really long. Marked me up for that. Marked me up for my tummy tuck. He turned around. He asked me, what's my profession? I said, oncology nurse or nurse. He like, do you do bone marrow? I'm like, no. So he was cool. He was cool. As soon as I got after that, got in the wheelchair, went into the room, got on the operating table. The nurse helped me. Then from there, the anesthesiologist like, I'm about to give you some medicine that burns. Boom. And now I felt like a taste in my mouth, and then I woke up in recovery. After I woke up in recovery, the nurses were talking to each other. I'm like, what's my blood pressure? They like, oh, mommy, your blood pressure good. What's my heart rate? What's my oxygen? The fuck? They told me. Took it. They like, your ride is here. I'm like, okay, cool. My ride is here. As soon as I stood up, I see why those girls have blood all over their socks. As soon as I stood up, boom, blood all over my socks. They cleaned me up, got me in the wheelchair. I got in the car, drove back to the recovery house. It didn't happen again. It just like a little bit, not as much. Took me in the bathroom so I could pee. Took off all my stuff, put on new clothes, put my compression socks on, cleaned my Crocs, put me in the bed, everything. Put my SCDs on, all of that. And I sat in there and I didn't want to message or talk to anybody. And then now I'm in a chair. They fed me chicken soup. I didn't want the crackers. The crackers are too dry. Chicken soup, Jello. Now they're giving me this, and then dinner is at 6. I also ate one of my fig bars. They also provide you with a call light, and they provide you with a cup to drink. So yeah, I've only taken extra strength Tylenol. So yeah, about to eat and watch TV. And I'm gonna get off of here. I'll check back in with what happened. I had the cough. Oh my God. I really need to take a strong, powerful cough. I don't know if I'll be able to do it. But it's no joke. You cannot cough, baby. But you have to. You wanna know why? Because sitting with phlegm will set up pneumonia.
Cross-examination. Cross-examination. Here we go. Good afternoon, Ms. Ritt. Good afternoon. Starting out respectful. Mr. Depp hasn't looked at you once this entire trial, has he? No, he's not. Not that I've noticed, no.
I need my best friend here. She's a respiratory therapist for the beat on my back. Because it's still in there. And I'm going to take a break for a second.
In San Francisco in July 2016. And this is after you've obtained domestic violence restraining order against him. That's correct. Oh, right in the audio. Oh, no, all this saying, all this, everything you just
My booty hurt too, y'all. I did not get a BBL, but like sitting in the same position, this recliner isn't the most comfortable.
You didn't think he would tell the world he was a victim of domestic violence.
Yeah.
I thought it would be crazy for him to do so. I know he lived through.
We're trying to take me out there, but I talked.
When Miss Bird said, tell the world, Johnny, tell them Johnny Depp, I'm a victim too of domestic violence.
I said yes.
It's her fault. Depp is your victim, isn't he? Oh, ma'am. And once he left you, continue to use
I really don't want to call them, but I feel like I'm going to call them and ask them to smash the pillow. It's my stomach as hard as they can while I take a really big, hard cough.
This is a battle of optics. This is not so much about the legal merits, but rather...
Y'all, I'm actually doing pretty good, and I'm only taking extra strength Tylenol.
If you just look at public opinion, no one really believes
I don't feel too bad. Maybe I have a high tide. Maybe I'm not a pussy like I think. Maybe I got a high pain tolerance. Let me find out. I'm like, my friends love me. I love them too. Even though we get in our scraps,
What did you say in response when
I love them for real.
Tell the world, Johnny. Tell them
And my
Johnny
little
Depp.
cushion.
I, Johnny Depp,
So,
man, I'm a victim too
I
of
need to
domestic violence.
get out of my depression mode and start answering the phone for them more. And hanging out with them more. I'm watching the Johnny Depp. I'm not really watching it, but
Yeah, Amber's fucked.
my breasts don't hurt at all. They just feel stinging, like around my nipple. Well, I think that's my nipple. I can't believe Dr. William gonna try to play me. Like, bone marrow, fucking nurses don't fucking perform bone marrow, nigga. I'm a real nurse, okay? No. Do you perform bone marrow procedures? No. Real quick. No. I don't even hang chemo because we have a chemo nurse for that. The fuck? But other than that, I feel like maybe he got the vibe. When I'm nervous, my vibe can be bad because, and it's nothing you're doing, which we all know. When something is going on, it's internal. Like if your vibe is off, it's internal, it's not external. I was scared shitless. He came in the room, I'm not smiling, y'all, because, I mean, I do smile sometimes when I get awkward, but this type of nervous was a different type of nervous. So I'm like, he like, hey, how are you? I'm not good. I'm doing good. I said, I'm just nervous. Like, you don't have to do any work. I gotta stop that though. But I let him know my emotion that I was feeling. Motherfucker was just nervous. The fuck? Let me text my little kid, young girls at my job. They CNAs. They both been going to nursing school. And I be trying to get them to vlog it. And so yeah, I just messaged them and let them know.
I was working on Pirates of the Caribbean 5.
I really want some hot tea.
She came a little later.
And what happened when Miss?
Like, to not be able to do shit by yourself, and I'm in the place of a patient. I've never been in the place of a patient. Never. Even with my fucking C-section. You know, I had the father to do everything. But having a complete stranger, this is a humbling fucking experiences. I feel like all nurses need to have surgery before they fucking start on the floor. Because, like, now, I see what my patients feel when they say they can't fucking cough. And it's uncomfortable. Even though, you know, woo, you can have a respiratory therapist force them to cough. I see what my patients feel when they say, I have to sit on the side of the bed for a little bit. Or when they standing up or whatever. I feel it. So, yeah. I feel it. I feel not being repositioned. I mean, I have been repositioned, but I've been on my booty for about an hour on my tailbone. So, I feel it. So, motherfucker, I'm humble. Not that I was a big-headed nurse, but now I'm a patient. So, I feel it, and I've never been a patient. So. I'm feeling sad, y'all. It could just be when I just was in the bathroom, I saw the side of my butt, and it's looking like that key area he does lowered my butt a little bit. It was still booty there. But I liked my high butt. I don't want it to look pinched. So it's looking like he lowered my butt. And I was nervous about the key area, but I still came to him. I wanted to look as natural as possible. I'm not gonna say what I should do. It's too late for all that. But I am feeling that. So I'm very tired. I think my body is really about to let me go to sleep now. So I will check back in with y'all for post out. Right. Okay, y'all. So I'm just checking in again because I didn't fall asleep. I keep having to pee. I done drank so much fucking fluids from yesterday to today that I keep having to pee. Non-stop. Crazy. I did get a good cough earlier. And this instant spirometer made me do that. I was using it. I'm gonna try to use it a couple more times. But I'm exhausted, so I really feel like I'm about to just try to go. Get some rest. Y'all, I took Tylenol PMs. And I cannot get rest because I keep having to pee. I have to pee again. Like, this is crazy. So I did pass out, y'all, on the floor. So, just to be safe, I told them to call 911 so that I can get my hemoglobin checked. See, like, if I need blood, and check my electrolytes and all that. check in with y'all and see, tell y'all how that's going. Still in the hospital. They admitted me. And they want to give me a CAT scan, but I just had a tummy tuck, so we have to figure out how I'm gonna lay down to take it. I'm just irritated because you just never think it's gonna be you. And I have to cough real bad. But I'll check back in with y'all. Okay, y'all, I just got back from the CT. This is how I did it. I took 2 pillows and told them I was gonna lay on my stomach, because you can lay on your stomach during the CT. From there, I got on the table with my knees and just hiked my butt up. So my body was kind of like this. My stomach was hiked in the air. I did have to lay on my boobs a little. They feel okay. And I finally took a Percocet. So I am going to stay in Miami longer than planned. Instead of leaving Tuesday, I'm going to leave Friday. So, yeah. They did a CT to rule out blood clots in the lungs. And my heart rate is going down. I really think it's because I was in so much pain because I'm trying to be superwoman and only take extra virgin Tylenol. So I'm going to start taking my Percocet and stop playing. I'm not a junkie, so. Other than that, nothing. I'm still NPO right now because I'm starving. But I will check back in with you guys when I get transferred, because they transferred me to the hospital that Dr. Williams has rights at. So, yeah. I'm at the new hospital, y'all, where Dr. William has rights. Trying to calm down. I'm just nervous, anxious, and I'm starving. All my scans came back good. They gave me cefepime. So yeah, I asked for some extra strength Tylenol. And yeah, I'll talk to you guys when I get into my hospital room. Morning, y'all. So I started taking real pain medicine instead of trying to be superwoman. I just take Tylenol. I feel so much better. Hold on. I'm trying to pop my phone up. Still got me on fluids. So yeah, I'm sitting on the edge of the bed, waiting for my nurse to come give me some for pain now. But yeah, I found the way to cough. I have to sit all the way forward and cough. They're still making me NPO. They're waiting for Dr. William to say that I can eat. But they haven't. So hopefully today he says I can eat. The main thing that's going on is my heart rate just is elevated. Like when I start moving around, it goes to like 150, like walking around. And then at rest, it's like 108, 119. So they're trying to get me to relax. And I really feel like, yeah, with the pain medicine, I'll be okay. So I'll check back in. I just stand up and I rock to make sure that I'm moving. Hi.
Good morning.
Good morning. Just to update, my hemoglobin went from 12 to 9. 12 to 8. So that was a lot. But it's not low enough to get a blood transfusion. So they're just giving me fluids and monitoring me. That's why I'm in the hospital. Because when you lose fluids, it makes your heart rate go up. And since I am like an anxious, nervous person, it's making me nervous, already, because I lost all that fluid. When I bend my arm, my thing says downstream occlusion, but I just fix it for the nurse because I'm a nurse. But so yeah, waiting on that. So I think they might try to start me on iron. And they just been giving me fluids. Like when I first came, they gave me 2 bags at the same time and 2 IVs. So I was like, hot damn. And I just feel like I wasn't mentally prepared. You have to mentally prepare yourself. To be having someone take care of you, to be walking slow, because when I was at the recovery house, I could not stop peeing. I was calling the lady like every hour to take me to the bathroom. It made me feel so bad, but I paid. This is for what you have to do. But I did feel bad. But the recovery house I stay at, top freaking tier. So yeah. So it isn't common, because I think I told y'all already. I did pass out. I passed out. And I was like, okay, let me check my blood sugar. Girl, I'm so extra. From DoorDash, I ordered a glucose thing so that I could check. It was good. So I'm like, okay, yeah, no, I need to go I told the lady at the recovery, I need to go to the hospital because I want to see what my hemoglobin is. Get to the hospital. I told them what my original hemoglobin was before I came down here, which was 12. They got it back. It was 9. So he ordered IV fluids, 2 bags. And the nurse started 2 IVs and ran them at the same time. Then they gave me a CT scan just to make sure I didn't have any blood clots. It came back negative. Chest x-ray, negative. Then I wanted them to transfer me to the hospital where Dr. Williams has privileges. The hospital I was at, he doesn't have privileges. So this hospital, he has privileges. And they did my hemoglobin again. It was 8. Because you drain like crazy from your back, because they don't sew up them holes. So you drain like crazy. Like I would stand up and it would just run all down my legs, like squirting out, like somebody had a water gun inside my body. And they was like, yeah, it's time. So that's how it was. And I didn't go into detail with that with my family because I didn't want to freak them out. I did tell them like I passed out. I didn't tell them every time I stood up, blood and shit was squirting out my back. So yeah, that. Just waiting. I have to wait for Dr. Williams to come see me in the hospital because they are scared to give me food or whatever. So yeah. And I am a very detailed nurse, so some of the stuff I've been asking them to order me, they've been like, Mike, give me a breathing treatment, mucolytic, I think that's what it is. It dissolves mucus because it's hard for me to cough, so if I get that, it'll dissolve it for me. Ask them to order that. Ask them to order me physical therapy because I'm like, the nurse doesn't have time to walk with me. I had said I need stool softener. I need Miralax. Okay. But yeah, I'm about to relax and stand up again. I'm gonna show y'all how it looks for me to stand up. And I can stand up pretty straight. Oh, no, no, no. Don't fuck with my heart. One day if I take you home, would you still be in love, baby? I have to go slow, though. And I can stand up pretty. Look at them titties without a bra on. That's crazy. But yeah, I stand here and I hold the table. And I rock. Pick my feet up. So I can expand my lungs. And I still have my SCDs on. I really want a nice shower. That's the only thing at the recovery home. Their water doesn't get super hot like hell, because that's how I like my stuff. It gets like not even lukewarm. Yeah, I rock. She liked the way I rock. I really want to look at my booty, but I really can't. And then it's hard for me to wipe my butt. I need to cough again. How I cough. I lean all the way forward. Ooh. That's not me wheezing, that's the machine. Because I make them listen to my lungs, because we ain't playing about me. So that's how I get it, the mucus to come up. Any little mucus that comes up. It's just the mucus that, and the mucus that I'm getting up is white. And just to educate you guys, I lost that much fluid from out my body within 2 days. That's a lot. So with me already being an anxious person, and then my heart is like looking for the fluid, that's why my heart rate has been up. Come on now, stop playing. Oh, I'm gonna need a piece of tape. That's what it is. Mucho, mucho. So yeah. Would you still be in love, baby? Students on the floor today. And so I got them to give me some juice. Because I shouldn't be NPO. They just talking about somehow they want to make me NPO. until Dr. Williams comes see me or somebody from his team. He's not going to say I need to be NPO. So, a girl has to do what a girl's got to do. I hope them students don't get in trouble, baby, because y'all sure wasn't paying attention because I'm NPO. Show y'all how I get in the bed. Awesome. Excuse me. Then once that is like that, I take this leg and put it as far over as I can. It's one of my dreams. Once I get that leg over, I take the other leg and put it in the bed. And then I take and pick myself up. Pick myself up and do it like that. And that's how I get in the bed. Got that film up too. That does take a lot out of me. Cause even when I'm a mess, I still put on a vest when it's on my chest. Oh yes, cause I'm super. Neck pillow. Check. Back pillow. Check. But that's how I do it. That is how I do it. La 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 la. Letting them transfer me, like pull me over in the bed or anything because they try to go too fast. And I'm like, no. My back be feeling like it's ripping. So I just do it myself. Okay, but anyway, so y'all, Dr. Williams is on his way to see me within an hour. I'm sure he's not gonna want me to record because, yeah. But I feel okay. I don't have no clothes on. I just have my bandages on because I can't wait for him to get here and change them. I really want to take a shower, but it's like the nurses and stuff they're scared to do my dressing changes, so I don't know. Me don't know. And I changed my date to leave to Friday. Ooh, I don't think it was worth it, y'all. I really don't, because it's just like, even when I get back home, I know I'm not gonna be able to be as active as I need to be with my babies. Yeah, I did feel bad about myself about my sagging titties, back fat, and all that. But to be in the hospital, my heart rate right now is 108, which is not bad. Because yesterday, baby, when I came to the hospital, it was 150. So it's like when I move, it gets up higher. But let's see. See, 105, 104. They did give me something to eat. I don't know if I know. I'm on a clear liquid though. So I ate and I'm back in bed. So I'll check back in with y'all when Dr. Williams get here and he talked to me and changed my dressing. So I'll let y'all know how that goes. Yeah, Dr. Williams just came and he looked at everything. He said I look good. He's actually gonna discharge me because he said everything that happened was normal. Passing it. So y'all know the real tea. Passing out is normal. Losing a lot of blood is normal. But they can't give blood. You know, if you're a nurse, you know you can't give blood unless you're 7 under. And if he could, he would give me a couple units of blood that would make me feel better. But he can't. He looked at my boob. He looked at my oxygen. He said it looked good, and he's gonna see me in the office Monday. I'm sorry, y'all, but my breath. All right. So basically, that's all. So basically, the real behind getting liposuction, tummy tucks, and all this shit, that losing your blood, passing out, feeling like you might die. Well, I didn't feel like I was gonna die, but I felt, I started thinking about like my kids, goddamn. So that's all normal. And he told me to just don't do anything without anybody. That makes me feel so much better. Maria, Maria, Maria. That's what I be feeling like. My nursing should be coming in here. Mucho. That's what I be feeling. So silly. But yeah. And I'm musty as hell. I had washed my vagina or my pussy, whichever one y'all want me to say, real good with this. Like a foaming cleanser. So I'm like, My armpits stink though. I ain't even gonna hold you up. Ooh. So, and it's crazy because I don't know if I told y'all, the nurses really don't understand me. I got my Lovenox shot today. So I've so far had 2 Lovenox injections, one in my inner thigh, and then I had the students. They had students do one right here. And tomorrow I'll do one right here. Or no, probably my inner thigh. So yeah. Yeah. I'm tired. I'm really swollen. I'm gonna show y'all a little bit. Warning, it's about to get crazy. I'm really bruised. You see that? He said that's normal. Really wish I could have something just hold it in. Cause baby, when I made he lipo my back, well y'all already know. If you know Dr. Williams, you know he lipos the fuck out your back. That's one thing he gonna do for sure is lipo the fuck out your back. That's why I wanted him. Yesterday when I was looking at my booty, it looks low because I have a really high butt. And you know, that key area he does. So, I'm like, I'm wondering about that. Really numb in that area. Twerk, twerk that ass. Twerk, twerk that ass. But I'm about to probably lay back. I'm going to brush my teeth. Oh, I can put some chapstick on real quick. I had to sleep with my hold the fuck up now. Hold the fuck up. Oh, what was I about to say? And let me make sure all my shit in here. ID, debit card, Capital One card, debit card, credit card, debit card, credit card, Sam's Club card, debit card. Yeah. Still all here. It's all there. Ready to get busy. I'm like, he's like, you enjoying yourself? No. To be honest. No, I'm not. The fuck? It's like when I'm nervous. Yeah, when I'm nervous, stuff just does not go right. I seem like a bitch. Because I don't want to play. I don't want to joke when I'm nervous. I want to be serious. You know what I mean? So, yeah. Trying to it. You look pale. Yes. What I've told y'all, but I'm being discharged. So I'm about to go back to the recovery house. Dr. Williams says everything that I experienced was normal. Passing out is normal. Lightheadedness, syncope, and collapse is what I had. That's all normal because my hemoglobin dropped. I was at 12 and it dropped to 8. So I had about 4 bags of fluid. So I feel, I mean, I'm not telling you I feel 100%, but I feel better. So yeah, I'm just trying to take it easy. That's basically what you gotta do, is take it easy. I'm glad he came though, because at first I'm just was feeling like, wow, he's not gonna, I didn't think he was gonna come. I'm not gonna lie. And that would have made me feel like a meat shop, because that's how 305 is. It's basically boom, boom, boom. But to know that if you do get hospitalized, Dr. Williams is going to come to you in the hospital if you go to the hospital that he is has privileges to, makes me feel better. Blanket hell, y'all. But I'm about to eat chicken noodle soup and crackers. She gonna make me some tea.
Mama said, you're a pretty girl. What's in your head? It doesn't matter. Brush your hair, fix your teeth. What you wear is all that matters.